Good afternoon, everybody. Happy Monday to you. It's a beautiful day out there. We got one good day out of the weekend, didn't we? So great to be here to chat with you this afternoon. We're going to talk about COVID, talk about the numbers, talk about vaccinations, and then, of course, we're going to take your questions and whatever's on your mind. We'll chat about that. So to begin with on COVID numbers are creeping up. And they have been creeping up for the last week to 10 days. Our health department put out a press release this morning. You probably have seen it on social media or something, just saying that, of course, we are monitoring the nationwide uptick in COVID-19 cases, especially among younger people, including youth. And everyone is concerned about that. We're all also concerned about what we see going on in Michigan, New York, Michigan especially. I mean, that's pretty close to us here in Missouri, so the upper Midwest. And we are trying to stay the course on the mitigation procedures in order that we don't see a fourth surge. And so I'll talk just a little bit about the numbers right here in the city of St. Louis. We have yesterday reported 53 new cases. Now, Saturday were 6 new cases, then Friday was 62, Thursday was 37, 29, 28. So looking at that as an average, we are now running a 7-day average of 33 new cases per day in the city of St. Louis. Now that is still lower than what is happening in the rest of the region. I have those numbers here. Let's see. Somewhere. At any rate, I'll find these here in a second. This is it. Thank you. So still our 7-day average cases is lower than the rest of the region, including St. Louis County and St. Charles and Jefferson County. The state of Missouri on average is averaging 10.2 cases per 100,000. We are averaging 11, so we are just a hair above the average in the state of Missouri. But, all of these, any uptick worries us. We know that there's a lot of folks are beginning to think COVID is over, but COVID's not over. And we have enjoyed for the last 2 months a real downturn in the number of cases, and in the last couple of weeks it has plateaued, and now we're beginning to see an uptick. That worries us. So please stick with your mask wearing, and especially if you have not been vaccinated. Keep your distance, your social distance. Continue to wash your hands. Don't be in a huge group of people all clustered together, because COVID is still out there, and in some ways it's still having its way with us. So that's the number of new cases. Now let's talk a little bit about hospitalizations. And these are the numbers from the 4 hospital systems that are part of the pandemic task force. The total number of people that are in the hospital today, either COVID positive or suspected positive, is 255. That's still below our metric that we set of 350. However, it's been creeping up. April the 3rd, for example, there were 210 people in the hospital, and it's been creeping up. It's been as high as 279 and 268, but today, and these numbers lag 2 days behind, I think you all know that, 255 people are in the hospital with COVID. Of those 255 people, 56 of them are in the ICU, so very, very ill. And of those 56, 35 are on ventilators. The daily average, the 7-day average of the number of people admitted to the hospital is right now sitting right at 40. And that is the metric that we set. Now that has creeped up from a low of in the low 30s, and then in the mid 30s, and then in the last few days creeped up to a 7-day average of 40. That's really driven by you know, one day we had 54 people admitted, one day we had 48 people admitted, and then back down into the 30s. But so those are the concerning numbers that we have right now. We just do not want to see that plateau turn the corner and head up again. So stick with the mitigation procedures. You all know what to do. We know that you're all tired of doing it, but please do that for yourself and for our whole community. Now, vaccinations. There have been 66,000 people in the city of St. Louis who have had at least one shot. That's good. We have about 260,000 adults. And remember that last Friday, which was the 9th, everyone in the state, including everyone, of course, in the city, who's an adult, 16 or over, can now get the vaccination. So as you all remember, for a long time, wasn't that long, but for weeks, you had to be 65 or you had to have an underlying health condition. That's no longer the case. All adults, anyone 16 and older, can get the vaccine now, can get the vaccination. This is really the only way that we are going to meeting the vaccinations with the mitigation procedures that we're going to try to drive these numbers down. It's very easy to get vaccinated now. Used to be difficult, but as I think all of you know, at the Dome, corner of Cole and Broadway, which is entrance C to the Dome, you can walk in between 8 in the morning and 6 in the evening and get a vaccination. Get your first dose of Pfizer. I know that all along we have encouraged people to get appointments, but that's not required. It might be a little easier if you have an appointment, if you go online and register, but if you have an hour right now, you can go to the Dome and you'll be most likely in and out within an hour. Some people are saying within 30 minutes, but we don't want to promise that. But you will be in and out of the Dome and you'll have your first vaccination. There are hundreds of people working at the Dome, many National Guard, many volunteers working there in order to register you, get you through the line, get the vaccination, then you'll sit just for 15 minutes, make sure you don't have any adverse effect, and then you'll be on your way. It's a very quick process. I think that's really the easiest way right now, especially because you can go, when you have an hour, you can say, okay, let's go do it now. We've got an hour, we've got the time to do it. There's free parking on Cole Street. This is also very easily served by Metrolink and also by buses. So that's easy. You also, they will give you a bus pass home and a bus pass to come back and go home again for your second shot in 3 weeks. So try to make this as easy as possible for everyone. No pre-registration, no wait, free parking, free bus pass, just really trying to make it easy for people to get the vaccine. So I hope that you and your friends and your family, if you have not already been vaccinated, will take advantage of this opportunity. There have been 6,874, I think that was as of the end of the day yesterday, shots given at the Dome. They can do more than that in any given day. One day they gave almost 2,000 shots, but yesterday, for example, was a little 1,100. Saturday was 1,500. So take advantage of this opportunity and please go get your vaccine. Just walk in there and do it. That's vaccinations. Couldn't be easier. So that's all I have for today. Do you have questions?
Just a few
Jacob?
questions. So
Okay.
on the COVID cases, Chris's question today, Mayor, has to do with the COVID-19 strains. Do we know if we have any evidence of the Brazilian or the South African strains in our area, or what the primary one is that we're seeing in our region?
Well, the primary variant that we're seeing, according to Dr. Eccles, is the UK variant. It goes by B117. But I believe that there are cases of other variants as well. And that, of course, is another reason to get vaccinated. So yes, this virus, like I've come to understand, every virus, or many viruses at least, they mutate and they change a little and they change a little. And so this one is no different than that. But they do believe that the vaccine continues to be effective, very effective, at keeping people from getting really sick from the virus and from these variants.
All our other questions have to do with the dome, pretty much. Is an ID required to get vaccinated at the dome, specifically if a 16 or 17-year-old are getting vaccinated with Pfizer?
They do ask for some ID, but if you're 16 or 17 and you don't have any ID, maybe you have a school ID. Maybe you have, most people end up with some kind of ID. So they want to just get the correct information for you. But I don't believe they're turning anyone away.
We did get a question from Chase about the people who are eligible at the dome, which I think he did mention this. His question is, any tier at this point can now show up at the dome to receive a vaccination?
Correct, Chase. The tiers are no longer relevant. We lived with the tiers for, 8 weeks maybe? Now every adult, 16 and over, is eligible.
Okay, we got a question from Paul about masks, Mayor. As more and more people get vaccinated, will the mask rules change in the city of St. Louis?
I expect they will eventually, but not right now. As you can see, we've got an uptick in the number of cases. We're concerned about Michigan. I mentioned that earlier. Michigan and other states which are really experiencing a fourth surge, so we're concerned about that. And we know that one of the most effective things is wearing a mask. The CDC recently came out with some new guidelines for people that are fully vaccinated 2 weeks beyond their full vaccination, that if everyone else is, then you may not have to wear a mask around them. But yes, masks are still required.
Adam's question has to do with masks, but asks Mayor Krewson, have they made a difference in the city of St. Louis, and how do you respond to people who have said that the mask mandates don't work?
Well, I think what works is wearing a mask. Whether it's mandated or whether it isn't, what works is wearing a mask, indoors and outdoors if you're going to be within 6 feet of someone. So we know that masks do work. In the city of St. Louis, masks have been mandated for quite a while, since July. We also know that the more compliance you have with masks, the better results you normally have. And the city of St. Louis has had really excellent compliance, both with our businesses as well as with individuals who are out and about. So we've had good compliance, and I think that's part of the reason that our rates are good.
Is the Dome event open to people beyond St. Louis City?
It is. It's open to all Missourians at this point.
And we have a couple of viewers today, 3 or 4, who are asking about some of our public health mitigation strategies related to businesses like bars and restaurants, and what that looks like moving forward in terms of the capacity and the time of operations.
So I've asked Dr. Eccles for a couple of weeks now to consider lifting the curfew, which isn't, it's not a curfew really, lifting the closing time at midnight, and to consider lifting the 50% occupancy and still requiring social distancing. At this point in time, he is not inclined to do that. And, as we see, we've got a little uptick in these numbers here. And so, we had really forced our numbers down considerably, but he has told me that he's not willing to make that change.
That's all the questions I have for today, Mayor.
That's all for today? You guys are so easy. Well, thank you all for being with us again today and staying up to date on COVID. we will post, we'll do a new post or a retweet of the way that you can sign up if you want to sign up to get a vaccination at the Dome. But as I mentioned earlier, you do not have to have an appointment. Appointments were frankly more for crowd control and to try to make sure the waits were not excessive. And we know that just as much as a month ago, people were waiting in line extensively. But at this point in time, there's plenty of vaccine. There's 8 o'clock in the morning till 6 o'clock at night, 7 days a week. So find an hour that you've got to go down to the Dome and get your vaccine. Thank you all. Really good to be with you today.